हैरेसमेंट अब बर्दाश्त नहीं होगी और इसलिए उनको पूरा संरक्षण देने वाला एक अध्यादेश आज लागू करने का फैसला हुआ है और राष्ट्रपति जी के हस्ताक्षर के बाद वो तत्काल प्रभाव से लागू होगा। ये संज्ञान योग्य भी होगा और जमानत न मिलने वाला होगा। 30 दिन में इसकी इन्वेस्टिगेशन पूरी होगी। सीनियर इंस्पेक्टर के लेवल पे ही इन्वेस्टिगेशन होगी और 1 साल में फैसला आएगा और कड़ी सजा का प्रावधान किया है।
Mr. Javadekar said the accused of the attack can attract a punishment ranging from 3 months to 5 years and a fine from 50,000 rupees to 2 lakh rupees. He said in case of grievous injuries, the accused can be sentenced from 6 months to 7 years and they can also be penalized from 1 lakh to 5 lakh rupees. Mr. Javadekar said if damage is done to the vehicles or clinics of healthcare workers, then a compensation amounting to twice the market value of the damaged property will be taken from the accused. Mr. Javadekar also said that in the last 3 months, the government has taken several steps in the wake of COVID-19 pandemic. He said the government took the decision of providing 50 lakh rupees insurance cover each for all healthcare workers, including doctors, nurses and ASHA workers. He also said that under Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, the beneficiary will get the treatment in COVID hospital free of cost in case of coronavirus infection, and in case of non-COVID diseases, the beneficiary will also be eligible to get the treatment in non-empanelled hospitals free of cost through the certificate issued by the government hospital. The minister said,
ये नए कोविड हॉस्पिटल बने 723, इसमें अब 1,86,000 लगभग 2 लाख बेड्स आइसोलेशन के तैयार हो गए हैं। 24,000 आईसीयू बेड्स हैं और 12,190 वेंटिलेटर्स हैं। तो ये सेवाओं का विस्तार 3 महीने में किया। जहां पीपीई की बात है, आज 77 डोमेस्टिक मैन्युफैक्चरर्स हो गए और 1,88,00,000 इतनी इनको ऑर्डर दी है और रोज सामान आ रहा है। N95 मास्क जो डॉक्टरों को लगाने चाहिए, जो आरोग्य कर्मियों को लगाने चाहिए, इसकी अभी उपलब्धता 25 लाख है और 2.5 करोड़ लगभग ऑर्डर दिया है।
With regard to the availability of PPEs and N95 masks, Mr. Javadekar informed that there are 77 domestic manufacturers of PPEs in the country. An order has been placed for 1.88 crore PPEs. He said the availability of N95 masks is 25 lakh. An order has been placed for around 2.5 crore such masks. Prime Minister Narendra Modi has said that the Epidemic Diseases Amendment Ordinance 2020 manifests government's commitment to protect each and every healthcare worker who is bravely battling COVID-19 on the front line. In a tweet, Mr. Modi said it will ensure safety of our professionals. The Prime Minister said there can be no compromise on their safety.
The Union Cabinet today gave its post facto approval for significant investments to the tune of 15,000 crore rupees for India COVID-19 Emergency Response and Health System Preparedness Package. Information and Broadcasting Minister Prakash Javadekar told about this during the Cabinet briefing today. The funds sanctioned will be utilized in 3 phases. Out of the total of amount, 7,774 crore rupees has been provisioned for immediate COVID-19 emergency response and the rest for medium-term support of 1 to 4 years to be provided under mission mode approach.
The key objectives of the package include mounting emergency response to slow and limit COVID-19 in the country through the development of diagnostics and COVID-dedicated treatment facilities, centralized procurement of essential medical equipment and drugs required for treatment of infected patients. It also focuses on strengthening and building resilient national and state health systems to support prevention and preparedness for future disease outbreaks. The package also includes setting up of laboratories and bolster surveillance activities, biosecurity preparedness, pandemic research, and proactively engage communities and conduct risk communication activities. These interventions and initiatives would be implemented under the overall umbrella of Ministry of Health and Family Welfare. Anand Kumar, AIR News, Delhi.
The Cabinet today gave its approval to relax the mandatory requirement of Aadhaar data seeding for beneficiaries of Assam, Meghalaya and Union Territories of Jammu and Kashmir and Ladakh for release of benefits to them under PM Kisan scheme up to 31st March next year. From 1st December last year, release of benefits is done only through Aadhaar-seeded data of beneficiaries uploaded by the state and UT governments on the PM Kisan portal, except in the case of states of Assam and Meghalaya and the UTs of Jammu and Kashmir and Ladakh, which have been given exemption from this requirement till 31st March this year, as Aadhaar penetration there has been minuscule. It has been assessed that it would take much more time for the state of Assam and Meghalaya and the UTs of Jammu and Kashmir and Ladakh to complete the work of Aadhaar seeding of data of beneficiaries, and the beneficiaries of these states and UTs may not be able to avail the benefits of the scheme from the 1st of April onwards if the relaxation from mandatory requirement of Aadhaar seeding of data is not extended. The Pradhan Mantri Kisan Samman Nidhi PM Kisan scheme aims to provide income support to all landholder farmer families across the country with cultivable land subject to certain exclusions. Under the scheme, an amount of 6,000 rupees per year is released in 3-4 monthly installments of 2,000 rupees each directly into the bank accounts of the beneficiaries.
The Cabinet Committee on Economic Affairs, CCEA, today gave its approval for fixation of nutrient-based subsidy (NBS) rates for phosphatic and potassic P&K fertilizers for the year 2020-21. The approved rates for NBS will be 18 rupees 78 paise per kilogram for nitrogen, 14 rupees 88 paise per kilogram for phosphorus, 10 rupees 11 paise per kilogram for potash, and 2 rupees 37 paise per kilogram for sulfur. The CCEA also approved the inclusion of a complex fertilizer, namely ammonium phosphate, under the NBS scheme. The expected expenditure for release of subsidy on phosphorus and potassium fertilizers during 2020-21 will be over 22,186 crore rupees. Prime Minister Narendra Modi will address various Gram Panchayats across the country on Friday on the occasion of National Panchayati Raj Day. Mr. Modi will interact with various participants through video conferencing in view of lockdown. Mr. Modi will also launch the unified e-Gram Swaraj portal and mobile app on the occasion. The unified portal is a new initiative of Ministry of Panchayati Raj, which will provide the Gram Panchayats with a single interface to prepare and implement their Gram Panchayat Development Plan (GPDP). The Prime Minister will also be launching the Swamitva scheme. Indian Medical Association doctors withdraw proposed protest after a high-level meeting with Home Minister Amit Shah through video conferencing. Health and Family Welfare Minister Dr. Harshvardhan was also present on the occasion. Mr. Shah appreciated the role of doctors in general and particularly in the fight against coronavirus, and expressed confidence that doctors would continue to work dedicatedly in this fight as they have been doing till now. He saluted the sacrifices made by doctors to keep the people safe from diseases like COVID-19. Allaying all concerns of the medical fraternity regarding their security in the fight against coronavirus, the Home Minister assured them that Narendra Modi government would leave no stone unturned in ensuring their well-being and security. Mr. Shah condemned the recent attacks on health professionals and said that the Prime Minister is closely following all issues and concerns of doctors. He said all necessary arrangements would be put in place to prevent such incidents in future. He appealed to doctors not to do even a symbolic protest as proposed by them, as it is not in national or global interest. Considering the immediate high-level response from the government and assurance given by the Home and Health Ministers, the IMA has withdrawn the proposed protest to maintain the fight against COVID-19 in an uninterrupted manner.
A total of 20,471 confirmed cases of COVID-19 have been reported in the country so far. Out of them, 3,959 patients have been cured and were discharged from the hospitals, while 652 patients have died. Health Ministry said Indian Council of Medical Research (ICMR) has forwarded a protocol for using rapid antibody tests to all the states. It is reiterated that antibody rapid tests are largely to be used as a tool for surveillance. The ministry said utility of this test is evolving globally and it is currently being used for detecting the formation of antibodies in individuals. These test results are also dependent on field conditions. As noted by ICMR, these tests cannot replace the RT-PCR test to diagnose COVID-19 cases. ICMR has assured assistance to collect data from various states to assess the scope and extent of utility of these rapid antibody tests in field conditions, and ICMR shall keep advising the states on a regular basis. The ministry said states have also been advised to follow the prescribed protocol for these tests and use it for the purposes for which they are meant.
Government has refuted claims that centre is preparing to procure thousands of wristbands which will be embedded with its Arogya Setu app to monitor movements of COVID-19 patients in hospital and home quarantine. Press Information Bureau said in a tweet that there is no such move and this is fake and baseless news. Gates Foundation co-chair Bill Gates has commended Prime Minister Narendra Modi's leadership in dealing with the COVID-19 pandemic in India. In a letter to Mr. Modi, Mr. Gates commended the proactive measures the Modi government has taken to flatten the curve of the COVID-19 infection rate in India. The measures include adopting a national lockdown, expanding focused testing to identify hotspots for isolation, quarantining and care, and significantly increasing health expenditures to strengthen the health system response and promote research and development and digital innovation. Mr. Gates also appreciated the Arogya Setu digital app for coronavirus tracking, contact tracing and to connect people to health services. Mr. Gates said he is grateful to see that Mr. Modi is seeking to balance public health imperatives with the need to ensure adequate social protection for all Indians. The Ministry of Information and Broadcasting issued an advisory to print and electronic media today, calling on journalists covering coronavirus-related incidents to take precautions. The ministry said it has come to its notice that a large number of media persons have recently contracted COVID-19 while covering the happenings in certain parts of the country. The advisory asked the management of media houses to take necessary care of their field as well as office staff.
Reports have appeared in a section of social media claiming that media reports that Ministry of Home Affairs guidelines for resumption of industries will lead to penal action against company directors and management. This is a fake news. According to the Ministry of Home Affairs, it is wrong and incorrect. The provision under Clause 21 of the guidelines is in nature of precautions for management of COVID-19. Citizens are requested not to pay heed to such misleading information and do not fall for it. Stay home, stay safe. Before we move on, a reminder of the headlines. Cabinet approves ordinance making acts of violence against healthcare workers as cognizable and non-bailable offences. Prime Minister Narendra Modi says ordinance manifests government's commitment to protect each and every healthcare worker bravely fighting COVID-19. Cabinet approves relaxation of Aadhaar data seeding for beneficiaries of Assam, Meghalaya and Union Territories of Jammu and Kashmir and Ladakh for release of PM Kisan benefits. Government gives post facto approval for 15,000 crore rupees investment for India COVID-19 emergency response and health system preparedness package. Kailash Mansarovar Yatra via Nathula Pass cancelled due to COVID-19 and India hands over 23 tons of medicines to Nepal to fight COVID-19 pandemic. For quick news updates, round the clock follow us on Twitter handle @AIR News Alerts. Union Minister for Petroleum and Natural Gas Dharmendra Pradhan interacted with over 1,000 LPG distributors from across the country through video conferencing yesterday. In the event, the minister lauded their good work in ensuring doorstep delivery of LPG cylinders during the lockdown. He also appealed to them to proactively reach out and maximize the delivery of three free LPG cylinders to Prime Minister's Ujjwala Yojana beneficiaries under Pradhan Mantri Garib Kalyan Yojana announced for the poor to help them fight the battle against COVID-19 pandemic.
In this difficult time, when COVID-19 pandemic has engulfed the country, frontline warriors like doctors, nurses and other medical staff are playing an important role in the treatment of corona patients. However, in certain places it has been reported that these warriors and patients are facing discrimination due to fear and misinformation about coronavirus. The government is continuously making efforts to allay the fear and misinformation associated with COVID-19. As a result, in several places where medical staff were attacked earlier, they are now being seen as heroes of society. Here's more from our correspondent.
India's premier health institute, AIIMS, has clarified that frontline health warriors, doctors and nurses do not spread this disease as they take very strong preventive measures. Therefore, the chances of the virus spreading from them are negligible. Doctors and other medical staff put their lives at stake while treating corona patients. As part of a civil society, it is the duty of people to stop stigmatizing and start empathizing. They should be welcomed rather than treated as threats. Together, this virus virus can be defeated and the fight should be against the disease and not the diseased. This disease does not discriminate and neither should we. With Bhupendra Singh, Suparna Saikia, AIR News, Delhi.
Reports have appeared in a section of social media claiming that government has launched beta version of Namaste app, a video conferencing alternative to Zoom. This is a fake news. According to the Ministry of Electronics and Information Technology, it is untrue, false and baseless. Government has not launched any such app. Citizens are requested not to pay heed to such misleading information and do not fall for it. Stay home, stay safe.
In our series Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Talking to AIR News, Director AIMS Dr. Randeep Guleria advised the people and especially to those in the hotspot zone to sincerely follow lockdown measures to break the chain of transmission of COVID-19 infection.
Everyone, especially those who are in the hotspots, to really sincerely, as citizens in a patriotic manner, observe this lockdown, because if we observe this lockdown in a sincere manner, we will be able to break the chain of spread and we will be able to bring down cases and be able to prevent deaths and conquer corona in India.
Dr. Rakesh Garg of AIMS Delhi said that the spread of COVID-19 infection takes place through a person having a travel history and as well as from those who have come in contact of the infected person.
COVID-19 is being spread from persons who have a travel history from somebody, or they have a contact which has come from somewhere else, person who is taking care of positive patients and they have not used proper precautions. So those are the things. If they have this positive history, then probably the chances of COVID-19 will be more.
Amid coronavirus pandemic, AIR correspondents spoke to people of various states about the benefits they have availed under the central sponsored schemes.
मेरा नाम बंसीलाल ग्राम बमरौली जनपद कौशाम्बी का रहने वाला हूँ। जो मोदी जी ने लॉकडाउन में जनता के लिए राशन वितरित कर रहे हैं वो हम लोगों को मिल रहा है। हमें लॉकडाउन से कोई दिक्कत नहीं है। हमारा परिवार कुशल है और लॉकडाउन का अच्छी तरीके से पालन कर रहे हैं।
मेरा नाम रिंकी देवी है। मैं गोढ़िया चमन की रहने वाली हूँ। मैं जनधन योजना वाला 500 रुपया लिए। हम लोग के बहुत सुविधा है। हम लोग सब लोग घर में रह रहे हैं।
Prime Minister Narendra Modi will interact with all the chief ministers of states on the 27th of this month. Mr. Modi will interact with them through video conferencing to take stock of lockdown situation in the states and the way forward after 3rd May when the second phase of lockdown gets over. In an effort to guard against fake news being circulated on various platforms, we bring you a segment on fact-checking and myth-busters. There is a misconception that coronavirus infection occurs with big hair and beard. Senior scientist of Indian Council of Medical Research, Raman R. Gangakarikar, has said that there is no risk of the virus from big hair and beard. He said it is a rumor and no such case has come to light yet. With over 3,000 coronavirus cases in Mumbai, the country's financial capital is struggling to contain the infection. With close to 200 cases in Asia's largest slum of Dharavi, the Maharashtra government has a huge task at hand to ensure that there is no community transmission. Considering the importance of Dharavi as a hotspot, the interministerial central team visited the area today to take stock of the situation. Here's more from our Mumbai correspondent.
The Inter-Ministerial Central Team has asked the Maharashtra government to increase the quarantine capacity in the city from 1,200 to 2,000 beds. Maharashtra's Health Minister Rajesh Tope said the committee has further recommended increasing the testing capacity and has also recommended to provide minimum oxygen supply to patients as it will help their easing distress if any. Assistant Commissioner of G North Ward Kiran Dighavkar said the Central Committee has expressed satisfaction over the civic body's fever clinic concept and suggested that it be replicated in other parts of the city as well. Mumbai's civic body had launched OPDs for people feeling feverish, especially in containment zones, to reach out to a larger population and enable faster contact tracing of positive patients. So far, about 47 people from these fever clinics have tested positive for coronavirus. Kunal Shinde, AIR News, Mumbai.
In West Bengal, another 32 COVID-19 positive cases have been detected in the last 24 hours. Giving this information in Kolkata today, the State Chief Secretary, Mr. Rajiv Sinha, told that 300 positive corona patients are under treatment at various hospitals in the state. He said that 15 persons died of coronavirus in the state so far, while 79 positive corona patients have been discharged after recovery. Our Kolkata correspondent has the details.
The visiting central teams had on-the-spot assessment at different areas in Kolkata and North Bengal. The Home Ministry deputed 2 teams to review the implementation of lockdown measures in the state. Meanwhile, the State Chief Minister Mamata Banerjee has alleged that a wrong propaganda is on about the state regarding fighting against COVID-19. The state government has arrested more than 28,000 people and seized over 3,000 vehicles for violating lockdown norms so far. Arijit Chakraborty, AIR News, Kolkata.
In Himachal Pradesh, State Rural Livelihood Mission has taken the initiative to help corona warriors by manufacturing about 5 lakh masks and about 1,000 personal protective equipment kits. Over 1,250 litres hand sanitizer were also produced under the mission. Apart from this, several measures have been proposed under the mission. A report.
In Himachal Pradesh, many initiatives have been proposed under State Rural Livelihood Mission, which would not only strengthen the rural economy in post-corona pandemic, but also provide financial stability to rural population. One such scheme under this mission, where Mahila Kisans would be trained to develop backyard kitchen garden in 1 bighah of land, for which they would be given seasonal vegetable seed and fruits tree sampling. Similarly, 10 boxes of beehives would be given to trained women self-help groups, and honey produce would be marketed through Him-Era shops. Chief Minister Jairam Thakur said that under the proposed 1 cow scheme, Indian breed cows would be provided to poor Mahila Kisans of self-help group at highly subsidized rate. Chief Minister said new initiative would also be taken under Mahatma Gandhi National Rural Employment Guarantee Scheme. There is no doubt Rural Development Department will have a vital role to play in ensuring economic revival at village household level during the post-COVID-19 pandemic. Sanjeev Sundaryal, AIR News, Shimla.
In Tamil Nadu, 33 new cases of COVID-19 have come up today, while 27 have been discharged. With today's new cases, the total number of infected in the state has mounted to 1,629, though the active caseload is 946. The death toll remains 18, with no loss of life reported in the last 24 hours. Here's more from our correspondent.
The State Chief Minister Edappadi Palaniswamy has announced that the ex gratia amount to the families of those frontline staff who die in the fight against COVID-19 pandemic will be increased from 10 lakh to 50 lakh rupees. Those at the frontline include doctors, nurses, paramedical staff, police and sanitary workers, among others. In addition, an eligible person from their families will be given government job. Furthermore, in the wake of the recent incidents in which the bodies of 2 doctors in Chennai had to be shifted from one cemetery to the other due to mob resistance, the state government has also promised to ensure decent loss rates for them. Jai Singh, AIR News, Chennai.
When the holy month of Ramadan is all set to begin amidst the COVID-19 pandemic, Maulana of Jama Masjid in Ahmedabad appealed people not to step out of their homes for offering prayers. In an appeal through All India Radio, he urged all the community members of Gujarat to follow lockdown norms seriously to fight against COVID-19.
मैं मुफ्ती मोहम्मद शब्दीकी सदर गुजरात चांद कमेटी व शाही इमाम खतीब व इमाम शाही जामे मस्जिद अहमदाबाद तमाम लोगों से अपील करता हूं कि तारीख 25 अप्रैल 2020 रमजानुल मुबारक का महीना शुरू हो रहा है और इस वक्त हमारा मुल्क एक वबाई अमराज में गिरफ्तार है। इससे बचने के लिए सिर्फ और सिर्फ एक ही रास्ता है कि हम ज्यादा भीड़ भाड़ वाली जगहों से बचें। इसलिए मैं तमाम लोगों से अपील करता हूं कि खासतौर से रमजान में इफ्तार पार्टी का इनेकाद न करें। तरावी की नमाज 5 वक्ता नमाज की तरह अपने अपने घरों में करें, अपने घरों में रहें, जिक्र इस्तिगफार में मशगूल रहें, कुरान की तिलावत करें।
In the Union Territory of Jammu and Kashmir, Department of Revenue is also working tirelessly to reach out to people and assist the administration in the prevailing unprecedented situation. The department is working at the forefront in coordination with other line departments in an effort to contain the highly contagious coronavirus pandemic in Jammu and Kashmir. More from our Srinagar correspondent.
The village committees comprising chokidars, patwaris and girdawars along with health officials and ASHA workers in Kashmir Valley, are carrying out commendable job in identifying the persons with travel history. The Tahsildars and Naib Tahsildars are assisting the authorities in identifying the red and buffer zones in a particular area. Meanwhile, with the spike of yet another 27 positive cases from Kashmir division today, the people of the valley at large should not get panicky. Instead, they should maintain the social distancing norms strictly and not to violate the lockdown that has been imposed only to prevent the spread of coronavirus pandemic furthermore. This is Sunil Kohl for AR News from Srinagar.
Sikkim government has decided not to host the Kailash Mansarovar Yatra via Nathula Pass in the state to Tibetan Autonomous Region of China, scheduled from next month due to COVID-19. State Tourism and Civil Aviation Minister B.S. Pant informed AIR that the state government has conveyed the decision to Union External Affairs and Home Ministries. He added that Sikkim government has decided to ban domestic tourists till October 2020 while completely restricting the entry of foreign tourists during the year due to the global COVID-19 pandemic. As part of the ongoing bilateral cooperation between India and Nepal to fight COVID-19 pandemic, Ambassador of India to Nepal, Vinay Mohan Quatra, handed over 23 tons of medicines to Nepal's Minister for Health and Population, Bhanubhakta Dakal, in Kathmandu today. The consignment as a gift from the people of India to people of Nepal includes 8.25 lakhs dosage of essential medicines, including 3.2 lakh dosage of paracetamol and 2.5 lakh dosage of hydroxychloroquine. This initiative manifests continuing cooperation of India and Nepal in all situations and circumstances. Nepal's Prime Minister K.P. Sharma Oli has expressed gratitude towards India for gifting essential medicines. In a tweet, Mr. Oli said, "I thank Prime Minister Shri Narendra Modi ji for India's generous support of 23 tons of essential medicines to Nepal to fight COVID-19 pandemic." The News Services Division of All India Radio in its bilingual live phone-in program today will bring you a special discussion on COVID-19. Dr. K. Srinath Reddy, President, Public Health Foundation of India, will participate in the discussion. Listeners can ask questions to the experts on toll-free number 1800-115767. This can be heard tonight on FM Gold Channel and additional frequencies from 9:25 p.m. onwards. And now, before we end, the headlines once again. Cabinet approves ordinance making acts of violence against healthcare workers as cognizable and non-bailable offences. Prime Minister Narendra Modi says ordinance manifests government's commitment to protect each and every healthcare worker bravely fighting COVID-19. Cabinet approves relaxation of Aadhaar data seeding for beneficiaries of Assam, Meghalaya and Union Territories of Jammu Kashmir and Ladakh for the release of PM Kisan benefits. Government gives post facto approval for 15,000 crore rupees investment for India COVID-19 emergency response and health system preparedness package. Kailash Mansarovar Yatra via Nathula Pass cancelled due to COVID-19. And India hands over 23 tons of medicines to Nepal to fight COVID-19 pandemic. And with that, we end the special news program on COVID-19.